everybody. I call this video Knowing Your Knees. Yeah, because it's a little bit different than our other videos in that our knee is adapting to so much of what's going on in the pelvis and in the lower body, the tibia, the fibula, and the ankle. So now there can be specific injuries to the knee, absolutely. But those knee issues that come on, I didn't do anything. I didn't fall. I didn't twist it. I wasn't playing soccer. I wasn't downhill skiing. I never fell. I never twisted it. The ones that just kind of come on over a period of time is usually something happening in the pelvis, and then the lower leg, the lower bone, the tibia in the lower leg will start to try to twist to pull the pelvis back. Okay, so yes. So definitely for those injuries that you've fallen, you twisted, you heard snaps, you heard all kinds of nasty things, heavens, please get to your doctor, get them to refer you to an orthopedic surgeon because you might have torn an MCL, you might have torn an ACL or whatever, you might have moved the meniscus out of place. An osteo can do quite a bit of work for that as well. But if this is just chronic pain that's come on over a period of time, this video might help you. And it's more information, and I'll show you a couple exercises, but it's more information than anything. So yes, the pelvis has a lot to do with it. So first up, as I've said before in many of the videos, you need to treat your scars, any pelvic scars. Now an osteo can do that for you, but you can do some self-treatment as well. So you have scars from hysterectomies, from appendix, from hernias, from resection, bowel resection, from C-sections, from gallbladder surgery. Any surgical issue here is going to cause issues in the tissues, absolutely, because scar tissue and fascia, which is that netting that's all throughout our body, they don't get along so well. Also, if you've had endometriosis or if you've had any bowel inflammatory issues, and most of us have had an inflammatory bowel at some point in time. We've had to go on antibiotics and then those flared up our bowel, etc., etc. So any inflammation will cause scar tissue in our torso as well. So you need to refer to the scars video that I did in both of these groups. That's when you're going to grab and you're going to lift and go to the ease and work on that. And usually one time doesn't do it. You've been dealing with the scar for a long, long time, or even if it was just last week, it's going to be a constant thing that you need to deal with. So scars first, all right? Now structure, again, see your osteopath to make sure that the SI joints are moving properly, that the vertebral column is moving properly, the sacrum is right where it belongs, all of these pelvic issues that you can have. However, you can do a lot on your own by doing the Aldoas. So Aldoa 1 through 5 down to S1, the Aldoa for the SI joint. There's a lot, the Aldoa for the hip flexor, the hip opener. There's a lot of them that you can do. So follow the hip video, follow the low back video, and do those exercises as well, okay? I'm getting to the knees, I promise. So for example, if you have a scar or if you have something that you haven't addressed in the pelvis and your pelvis is rotated to the right, this femur is going to internally rotate as well as the tibia, but the tibia is going to say, whoa, 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 we got to get her straight, we got to get her straight. So it's going to rotate to the left this way, and then you've got a torsion in your knee. Not good. So fix the pelvis, help the knee through either taping it or lemongrass. Lemongrass essential oil is amazing for ligaments that are overstretched. Apply lemongrass. Those might help, or again, see your therapist. So there's two common things that I see with knee, and this is more prevention. So we have what's called a valgus knee or a varus knee. So a valgus knee is when the lower part of the leg is out like that. Okay, and that's quite an advanced valgus. Varus is when it's in, like that. And so therefore, I don't know what's going on with my tibia here, my patella is not lined up very well. This guy, there we go, poor Carl, I'm so sorry. This guy's name's Carl, by the way. So there, when you have valgus or varus, the tibia plateau is not perfectly level. And these meniscus, these little shock absorber inside the knee can shift and move. And when they shift and move, you're going to get pain because it does not want it to shift so much and be popped off to the side or tore off or any of that kind of stuff. Okay, if you've had knee surgery, again, you need to refer back to the scars video and do scar work on that knee. Okay, so one thing you can do, I'm just going to move Carl out of the way, and that valgus or varus knee will also affect the ankle. All right, so in your foot and your hip. So it's hard to know which came first, the cart or the horse. Usually it's something in the pelvis, and then over time you've got a valgus or a varus knee, and then the ankle goes out, so you have to fix the pelvis and deal with the others. So one thing that you'll be able to tell is, let me move this chair back a little bit. You'll be able to look in the mirror and you'll see if you're like that. If your knees are in and your feet are out, that's what's called valgus knee. That is mostly coming from an overstretched medial collateral ligament. That happens because of being valgus for so long, but it's usually glutes not firing, glutes not activated. So you've got to activate the glutes. A varus would be the knees in like that, and that usually means you're quad dominant, and again, glutes aren't firing. But most of the time I see varus or valgus. I see that a lot. So you're in a chair. One of the things I see a lot of people getting in and out of a chair is they'll get up and that knee will cave in. You see that again? And they'll go down and the knee will cave in. That's telling me that glute, that left glute's not firing. So you're compensating to try to get in. You're trying to use your quad. You're trying to use other muscles to get yourself up. So that becomes one of our first exercises, is in and out of a chair, up and down stairs, whatever, being aware, doing step fitness. Absolutely. People go, step fitness, that's really hard on my knees. Remember, step aerobics was invented by Jim Miller, who was recovering from a knee injury. It's one of the best things you can do for your knee. But if your butt's not firing, you're going to get a strain in the knee. So you've got to come back to that, pull back to that glute core. And there's another one, another video that we want to do, the glute core. So getting out of up and down out of a chair, you can pretend you're pushing your knees into these imaginary hands out here and activating the glutes. Coming down, same thing. Keep them aligned. Keep them aligned. Push the knees without getting them into varus. Keep the knees aligned. Push, push. You can even take a TheraBand and wrap it around your knees. Or your extra cuff might be too wide and not quite intense enough, but you can do that, making sure that that stays in line. When you're doing step aerobics, keeping that knee aligned with the ankle. Okay, if that doesn't work, you might have a twist in your tibia bone. Yes, bones can have twists inside them. They are live tissue. Sometimes they twist so much that they break. Not just in everyday life, but a skiing accident or a soccer accident or something like that. They can twist and then actually break, but they will twist to try to bring that pelvis back. So you can do these exercises, but you still have that issue in that tibia, which needs to be treated. So that's when you have to come to your therapist. But this is more prevention, and I wanted to make sure that you knew about that. Knees, knowing your knees is usually knowing your pelvis and activating those glute muscles. Now another exercise you can do, I'm not sure, I'm going to just turn this a little bit, is if you have a wall, or in this case I have a pole. So awareness is the first key. Looking at yourself in the mirror, see if your knees are like this or like that, and lining them up and activating those glutes. That's the first step. And of course, short foot. And to know what that is, refer back to the Fabulous Feet video. So short foot, and that will lift up the pelvic floor. Everything will be activated. It's just, if you can get to that point that it really stays on, we're in good hands. So you want to get a thick towel, and you're going to put it against the wall, or in my case, a pole. And I'm going to push my knee up against the pole or the wall. All right, and then I'm just going to push that without me being so far away that my knee actually goes out of alignment, because I'm in short foot. I take my back leg back, and I'm just pushing, and I'm doing a little lunge. Now I'm into my glute here, into my left glute, fired up, fired up, fired up, fired up. Good. And then we can switch to the other side. Excuse my back. All right, so I'm putting my, they're doing here. Put my knee up against the wall or the pole, whatever you've got, against the towel. Nice and strong. And getting in, pushing into that pole with my knee without losing my alignment. Up and down, activating that glute. All right? And then when you're going up and down stairs, or you're doing step aerobics, or you're sitting in a chair, you're always thinking about then activating those glutes, keeping the knee lined up. Now, if you've got an injury in there, you might feel a little bit gushy, a little tension because it's a bit swollen. So you could try some ice, you could try some arnica gel. I find that any arthritis that I have in my body, I have quite a few spots, I do what's called a little roller ball that I call Joint Joy that has Panaway and wintergreen and copaiba. These are amazing essential oils that help reduce inflammation. So talk to your doctor about reducing your inflammation to get through that issue, and do the awareness check for the pelvis every time you're getting up and down chairs. Refer back to the hip video, the low back video, the core and restore video, the fabulous feet video, and your knees will come along for the ride and they'll be very happy. All right, again, not many exercises that we need to do for it specifically for knees, because it's usually happening somewhere else. That's knowing your knees. Take care, have a great day. Bye-bye.